Hi guys, it's Dawn from Dawn of Healing. And while we're waiting for some of the other fun stuff to arrive for my future videos, I thought I would kind of give you a rundown of my diagnosis so far, since that's the whole reason we're starting this journey, right? So, okay, from the beginning, in early August, I was at work. If you recall, I'm a licensed massage therapist, so that particular day I was working in the spa, and I was standing against the wall waiting for my client to come out, and pushed off the wall with my back and turned at the same time. And I got a really sharp, painful twinge in my right lower back, and my entire right leg, all the way to the toes, went numb. And so by the time I went to finish that step and put weight on that leg, the leg was not really there to support my weight, and so I fell. So I didn't think too much of it. I just kind of laughed it off and picked myself up and walked my client out and that kind of thing. But as I was driving home, there was more and more pain in my lower back. And when I got home, I was pretty well wrecked and laid on the heating pad. And my husband said that, I should probably let my work know what was going on. And he wanted me to file a workman's comp claim. Anyway, he just went kind of nutso with it. So, but he's usually right. So I went ahead and messaged my boss and let her know, hey, this is what happened. I'm still in a lot of pain. I'm not sure if I can come to work tomorrow. And she says, fine, that's fine. Let her, keep her updated. So the rest of that night, I just kind of limped around, and my kids were very helpful bringing me things to the couch. And, I just kind of relaxed and figured, I could probably go to work in the morning or whatever. But in the middle of the night, I needed to get up and use the restroom and needed help getting out of bed and then getting back down onto the toilet. And so that was really disconcerting. So I went ahead and let my boss know, hey, I'm not going to make it to work today. There's no way that I can give a full body massage and be useful. Standing for too long or sitting for too long or is just painful. So I went ahead and emailed her boss and said, hey, this happened at work. Because it happened at work, my husband feels that I should make this claim. I wasn't going to say anything, but blah, blah. So I did. And I have been out of work ever since, as of this video on October 9th. So that's about 2 months that I've been off of work for this. So initially I was sent to an occupational health physician who diagnosed it as a pinched nerve at the L3, L4 lumbar vertebrae junction. And that would be what was causing the radiculopathy down my leg, and then, obviously in my buttocks and then up my back some. He said it could do that too. So they sent me for an MRI, and that came back with degenerative disc at L5S1. I've heard it called degenerative disc disease and some form of arthritis. So that's, it was the first confusing messaging. Why is there a pinched nerve at L3, L4 if the degenerative disc is at L5S1? Is it degenerative disc disease or some form of arthritis? So that's unclear still. So after the MRI and showed that it was no structural issue, like there's nothing, the bones haven't collapsed. There's no, rubbing of bones up against each other. No bone spurs or broken anything. I got approved for physiotherapy. And I did 12 physiotherapy sessions, and in those sessions, it relieved some of the tension from the pinched nerve, though I still have, to this day, the sharp, pulsating twinges when the nerve gets irritated or inflamed. But we could kind of start to differentiate the pain between the pinched nerve and what's happening at the L5S1 at the sacrum, because that's more of a burning, radiating sensation at the sacrum than from the pinched nerve. But then other things started to occur. I started to have a lot of compensation pain on the left side because those muscles have been overworking to compensate or to make up for the lack of muscular support from the right side. And some of that is because they're guarding so hard. They're saying, hey, I don't want to be hurt anymore, so I'm just going to hold stiff. Some of it is because the nerve is impinged. It causes, that nerve in your lower back innervates the muscles for the entire leg. Mostly for the L5S1, and I guess L4-5 innervates the back of the leg and the lateral aspect. So that's the outside of the leg for those of you who are unfamiliar with the terms lateral and medial. Medial is in the middle, lateral is on the outside. So the weakness in the leg is pretty typical with a pinched nerve because that innervation is not being sent all the way to the fully down the innervation pathway. So, the physical therapist noticed a little bit of a foot drop due to the muscular weakness in that leg. And then he's noticed, the compensation. On top of that, physical therapist said that I have between a 5 and 20% dysfunction in my SI joint. So that's sacroiliac joint. So that's the sacrum, which is that triangular shaped bone at the end of your spine, just before your, as part of your tailbone, kind of and the iliac, so where your hips curve up in the back, you have that nice crest where you can set your hands on the bones. So where those come together, that curved ilium and the flat, the triangle of the sacrum at that juncture is the sacroiliac or the SI joint. And he said one of those is tilted more anteriorly or toward the front than the other. And so we spent a lot of those 12 sessions working out, making that in the pelvic tilt equal on both sides. And with that comes a lot of glute pain, because you're working all of those stabilizing muscles. We were working my erectors, so the multifidus and I'm blanking on my muscles, but I'm going to actually make a video where I take my oil pastels out and we're going to draw the structures in that area for this diagnosis, because we're just going to have a lot of fun since I'm, having to really focus on this area for all of my exercises and my recovery and my weight loss. So we'll do that musculature and the bony landmarks and everything for that too, so we can get really in depth into the lumbar spine. And the glutes. I don't know that I will draw the glutes for you, but I might put them on a transparency and lay them over my my model's glutes. But so we're working all of that area, and those muscles are getting really, the innervation is low because of the impingement higher up in the innervation path. So the muscles are weak already, and then we're working them. So there's a lot of soreness and achiness, and sometimes there's pain if I try to push through that pain barrier to kind of come out the other side. That no pain, no gain really doesn't work, especially when you're working with an area of a body that is responsible for so much structural integrity for your entire skeletal system. So we finished the 12 sessions, and he recommended another 6. Went back and saw my occupational health doctor, and I said, I'm also having this issue that my physical therapist and you can't seem to assist in understanding. And that's been since the injury in my lumbar spine. There's a popping, but it's not like you pop your knuckles. That just relieving of air pockets or increasing the flow of synovial fluid in between. It's more of a shifting or a grinding of those vertebrae. And it happens anywhere on a daily basis, still to this day, anywhere between 3 and 20 times a day. And that's really disconcerting. Sometimes it is just a shift and a grind, and it just kind of makes me catch my breath, and I'm like, oh God, what was that? And sometimes it's painful, just with the grinding. Sometimes it's loud and popping with no pain. Sometimes it's loud and popping with pain. And so there's not really a set pattern that I've been able to discern at this point. And so I said, let's hold off on the physical therapy until, I'd really like to see a back specialist, excuse me, to kind of see if they can sort out what that is, and if continuing physical therapy is a good idea. So, and this is where it gets interesting, as if it weren't enough already. I went to this back specialist just a couple of days ago, and they did x-rays, which I hadn't gotten before. I just did the MRI because they were pretty sure it wasn't structural, but this guy's he's an osteosurgeon, so I guess it was an orthopedic specialist. And so I did the x-rays. They said, once again, my films look great for my age, which I'm 38. I'm proud of it. My skeletal structure looks wonderful. But they did see a bulging disc at L5. And this was completely new. Having, a bulging disc means that, and I'll, we'll work through that too as we kind of pick apart each of these diagnoses. You have the vertebrae stacked on each other, and then in between, there's this not quite rubbery, not quite fluidy, but a little bit of mix of the two, disc. And the annulus of that, which is kind of the inside, can bulge out. That fluid can kind of be pushed to a weak spot in the disc. And he says the bulging disc is what's impinging the nerve, even though the previous doctor said it was at L3-4, not L5-S1, where the impinged nerve is. So now I've seen 3 different doctors and gotten 3 or 4 different diagnoses for what's wrong with my lumbar spine in that area. But then he tells me that the bulging disc is an incidental find, which they find completely insignificant, and it shouldn't be causing anything, which is weird because he just said that was what was impinging the nerve. So at this point, I'm very confused in my diagnosis, and I asked him, well, maybe, I'm 20, 30 pounds overweight, as we kind of mentioned the other day. I still haven't looked at the ideal weight chart, but I'm pretty sure for 5'10", it's between 150, 165. So I asked him if he figured maybe that was impeding my progress through my recovery. And he tells me that by my state standard, which I'm currently in Alabama. I was a military baby, moved all over the place. My husband and I love to travel, and we currently are residing in Alabama. And he said, by Alabama standards, I'm anorexic. Now, I have many issues with this statement. First of all, anorexia is a very serious condition. It's an eating disorder. I love to eat. And anorexia is where you have such a, you constantly view your body as overweight. And so you starve yourself in order to get down to what you believe you should look like. 2 things. A, I love to eat. So I don't have an eating disorder, which causes me to starve myself. And B, if I'm overweight, I can't, with anorexia, you're almost always underweight, right? It's a pretty serious condition that causes you to constantly be underweight and malnourished because you never view yourself as that beautiful, ideal weight. You're not satisfied. So he lost a lot of credibility with that by saying that I'm overweight, but I still don't weigh enough. That's definitely not true, especially by medical standards, and I'm not sure why he would bring that up. The next place that he lost credibility with me personally is he said he doesn't believe in my work as massage therapists. He doesn't believe that you can manipulate soft tissue to relieve stress and pain, that there are subtleties in your work that can change the subtleties in your body structures. Now, there are centuries of research that disproves his lack of understanding. And I've seen it in my patients on a daily basis. I've felt it in myself when I receive massage. So by telling me that my work is illegitimate was really A, rude and unprofessional, and B, really just kind of lost that patient-doctor connection. And then the third is he said that everything that my other doctors had said was completely bogus and I should only believe him, and I needed these injections, even though, and if the injections should relieve my symptoms, and if they relieve my symptoms, then I know what's wrong with me. And I'm not the type of person to just throw a bunch of stuff at the wall and see what sticks. You know, I kind of want to know what's going on with my body, especially understanding the structures as I do. You know, I'm not perfect and I don't understand everything. And I'm going to make some videos to teach myself and then see one, do one, teach one, right? Like I'll see it in a book myself and then I'll teach you guys to do it. And you learn best through teaching. So that's kind of where I'm at now. Four different things that are going on within me that are causing these issues. So the next step is I will be seeing a different back specialist or orthopedic specialist, whichever is assigned. And I will probably continue with some physical therapy now that, even though he still can't tell me what's making my back pop, I will continue with the physical therapy and hope that the back popping is not, the films don't show any structural issues with continuing physical therapy. So I'll do those. I have about 6 sessions and then we'll kind of go from there. So that's, you're all caught up. 2 months in a nutshell. And so, you know, just one day at a time, and I will keep you guys posted and I will make all of those videos so we can deeper understand, especially this area of the body. So, thank you for watching my video. I hope you decide to like and subscribe so that you can continue on this journey with me, and, you know, we'll just make our own world. All right, have a great day, and we'll see you next time.